So today we're doing something a little different. We are debunking a few medical advice that we pick from the street. See, this so-called medical advice could be coming from either daddy, mommy, a neighbor, or just someone we hold in high esteem. It could be coming from anywhere. And they are so-called because in as much as it's not coming from a medical personnel, in fact, the ones I have listed down, I want to believe that they cannot be coming from a medical personnel. So I'll be more like rephrasing the very few that I have, putting it right, and just correcting a few of these medical interventions. In fact, they are so-called medical interventions. So anyways, my name is Anastasia Obilo. I'm a registered nurse in Nigeria. I make content based on my nursing journey because, of course, I'm a nurse. I share health tips just like this one we are about to dive into, and lifestyle content. So if this looks like things you're mostly interested in, please join the family. And if you know someone who might be interested in content like this, please do well to share my videos, and let's just get into the video. So number one on my list, so-called medical advice to debunk, is if you hold your urine for too long, your bladder will burst. So here's something you should actually know about your urinary bladder. Our urinary bladder is more like a balloon-shaped hollow muscular organ. Yes, and is located in the lower part of our abdomen, which is the pelvis. And there are supportive pelvic floor muscles that help hold this bladder in place. So the first question is, how long is too long? Because our urinary bladder has the ability to hold urine for 2 to 5 hours. So how do you know your bladder is full? There are sensory nerves that travel to your brain to control the release, hence the urge to urinate. And thank God for our external urethral sphincter. We have control, I mean voluntary control over it. But I'm not saying hold your urine for as long as you want. Either way, you get very uncomfortable. When the urge to pee comes, can you hold it for an hour? It's very uncomfortable. But there are rare cases where this can actually happen. But I wouldn't use the word burst. I think rupture is the word. Cases like a tumor in your bladder, damage from radiation, or a major trauma to your pelvis, more like a fracture. So these are very rare cases in which your bladder can actually rupture, and not from holding your urine. So number two on my list is, if you have sex, you get pregnant. I know. What is she saying? It takes sex to make a baby.
What are you saying? What is he saying?
So here's what I mean. As a woman, if you're not ovulating on your ovulation window and you have sex, you can't exactly get pregnant. Or should I say, it's not supposed to happen. Because an egg has to be released, travel to the fallopian tube, and fertilized by the sperm. So if you don't have sex 5 days leading to your ovulation, because in these 5 days you are still most fertile, and this is called your ovulation window, or on the ovulation day, and by the way, that lasts for 12 to 24 hours. So if you can escape this, you may not necessarily get pregnant. But it's not the same for women with irregular cycle. And that is where caution comes in, with contraceptive options, of course, recommended by your doctor. Or probably you have a regular cycle, but you just find this whole thing difficult to track. So my point is, it doesn't only take sex to get pregnant. A woman has to be ovulating to actually make a baby. So number three on my list is, a child is lazy if he doesn't meet his developmental milestone. Who told you that? Where did you hear that from? Especially when it comes to crawling, walking, or speaking when the child is supposed to, or when you expect the child to. Or maybe compared to your neighbor's child that is telling you that, oh, my child did this a lot earlier. Some children are just lazy. First of all, these children hit these milestones at their own pace. In fact, there are no two children with the same developmental milestone. And besides, there are a good number of reasons why a child could be having delay with meeting his milestones. It could be hereditary, which is one, or a sign of ASD, which is autism spectrum disorder, used to describe several neurodevelopmental conditions. So if you suspect any form of delay that causes you as a parent or guardian to worry, please see your doctor for proper diagnosis. So number 4 on my list is that if you have an elevated blood pressure or you've been diagnosed with high blood pressure, you're thinking too much. It's like, what are you thinking about? Why worry? So worry and stress is not the only reason behind having an elevated blood pressure. There are other factors that could be responsible. There's too much salt intake, overweight, smoking, or you have an underlying health condition such as a kidney disease. That is why, again, proper diagnosis is required. So number 5 on my list, which is the last but not the least, is putting spoon in the mouth of someone having a seizure. No, please do not do that. You just end up causing more harm than good. So here's what is advisable to do before taking the person to the hospital. So first of all, ensure that the person is laying on their side instead of laying flat. If the person is putting on any tight clothing, please help loosen the clothes. Ensure that the person is breathing. If there's anything around, laying around that can cause harm, please take it away. If there's vomit, you wipe it off. And again, please do not try to restrict the person by holding them down. Allow the person. Instead of trying to hold the person down, try and record to see how long the seizure lasts. It will be very useful when you get to the hospital. I know it sounds very unrealistic to say record how long the seizure lasts, but that is the least you can do. I know at this point, the person saying this is either restless, cannot stay calm, but that is the least you can do. Stay calm and then record how long the seizure lasts, because it will be helpful when you get to the hospital. Once the phase passes, then you can go to the hospital. If the person is having repeated seizures or is lasting more than 5 minutes, please go to the hospital. So that brings me to the end of this video, and I'm hoping you picked something from it. Just share your thoughts with me in the comment section. Which one is coming to you as a shock? Is there anyone you're guilty of, or do you know someone who might be guilty of it? Which one did I not mention? Please share your thoughts with me in the comment section. Let's have a conversation in the comment section. Okay, that looks like a rap line. Anyways, please do not forget to give this video a thumbs up if you liked it. Subscribe to my YouTube channel. Share this video to someone you know needs to watch this. Like, you know that person. You know that person that needs to watch this. So feel free to share this video. And until my next one, bye.